But good morning, everyone. Thank you for joining us in our meeting or our presentation today. As Faith mentioned, my name is Ruth Morales. I'm the Community Outreach with the Drug Enforcement Administration Los Angeles Division. Pretty much my role in this capacity is to connect with the community, to do a lot of prevention and education opportunities in our area of division of what we have, including LA County. So I'll go right into the meat and potatoes of it. So before I go into our main topic of fentanyl, I wanted to highlight a little bit what the primary role of DEA is, and what we are known to do and what we do with the different programs. So pretty much what DEA is known is for enforcement. You might see it in the news, you might see it in movies and media like Breaking Bad and Narco. And this is pretty much the main focus of the agency is enforcement. So we have special agents that investigate the illegal distribution of drugs, trafficking, not just here in the United States, but across the world. So we have offices domestically and also internationally that do and work with counterparts on the illegal distribution of drugs. On the other side, we have what's called Diversion Control Division. And this is where we have diversion investigators investigate how doctors, how pharmacies, or anybody that has a DEA registrant, how they distribute and how they give drugs to patients. We know that there is cases where doctors or pharmacists or anybody that has a DEA registrant abuses their power and makes this a market where they're making profit out of selling and distributing medication that is legal. So not only do we look at the illegal side of drug distribution, but we also look at the legal side from actual pharmacists, doctors, and so on and so forth. So DEA's overall mission is to control all the drug laws that we have and regulations, and making sure that the distribution line is being used for medical necessity and not just for purpose or own gain. And so a little bit of the work that I do is under the community outreach section. And this is really a piece where DEA can connect with community members, community groups, and work together. Really, DEA can't be everywhere. There's probably 2 or 3 people that do a similar job that I do here in the office. And so we really work with school officials, community groups, community coalitions to spread the message on the dangers of drug experimentation and bring more awareness to drug prevention. And so the way we do that is go to schools, bring our mobile command center. Not only do we talk about the drug prevention side, but we also talk about what it looks like as having a career within DEA. So wanting to be an agent or wanting to be an intel analyst, giving youth an opportunity to know more about the positions that we have. And then we work with organizations like the LA Sparks to bring youth an opportunity to have alternative measures and engage in a team effort and learn more about themselves. So today we'll be primarily focusing on the One Pill Can Kill. This is a campaign that was created by DEA. It's not trademark. It's something that people can use, that people can download information, and I'll have a couple examples of what it looks like. But it really is to bring awareness, and as I mentioned, to really spread the information from peer to peer, from train to trainers, and ultimately save lives by bringing awareness to the fentanyl crisis. So this all began a couple of years ago, and it pretty much spiked in 2019, 2020, when we started seeing a lot of headlines just like these that you see on the screen. A lot of emphasis and focus on teen overdoses and fake pills or counterfeit pills. And over time, these words or terminologies have changed. With everything evolves, DEA likes to change and keep up with the current news on what's going on. And the overall arching of every headline that you would see is that teens didn't know that what they were seeking, or what they were having it at their disposal was actually fentanyl pills, um, and not something that they were looking like oxycodone or a Xanax or anything along the lines. And I'll talk a little bit about the difference so we can highlight what each one looks like. So when I do my presentations, I like to highlight the two different types. Um, Fentanyl or prescribed fentanyl is something that is used in the medical field. This is actually prescribed to somebody that has intense pain, or has something like cancer that has extreme amount of pain. And this is something that's regulated. This is actually something that's prescribed and monitored by a medical professional. What we're going to talk about today is not that. It's the illicit market of fentanyl, something that's not made in medical labs, and it's not something that's controlled. And so when we talk about drug poisonings or overdose deaths, it really is the illegal fentanyl that we're seeing in the communities, that sometimes might look like an actual prescription pill, and which is really much the driving force of the deception on a lot of the deaths that we've been seeing due to fentanyl. And so, just the overall, what is fentanyl? It is a synthetic opioid. It's a man-made opioid, that is 100 times more potent than morphine, 50 times more potent than heroin. Um, if you note something out of this moment, it's that it's pretty strong than anything that we're really seeing. And with these fake pills, they're meant to look like oxycodone or hydrocodone. So they're actually to look like medication that you would get from your doctor. And they're pressed to look into different things, as I mentioned, like an oxycodone or a Xanax and Adderall. So the next couple of slides will show and highlight that. And so these pills are being pressed down in Mexico and being shipped across the United States. And yeah, it's very scary. As I mentioned, they're looked to look like an actual oxycodone. Some of you might have seen this image. It's a well-used image. This is 2 milligrams of fentanyl, and this is a lethal dose of what fentanyl looks like. It's on the tip of a pencil, and pretty much that's all that's needed. Obviously, drug experimentation. If somebody already has used drugs, their tolerance might be different than somebody that has never experienced with any type of drug. But this is a lethal dose of fentanyl. That's honestly, even if you have like a sweet little packet, that's typically what we use when we do presentations as well, to showcase that a sweet little packet can kill up to, I think it's about 500 people. 500, I think it's 500 people. So this is more of a educational piece of showcasing what a lethal dose of fentanyl is. As I mentioned, oxycodone is one that we really see when we do seizures. That's like the M30 pills that are blue pills on the left. Then we also see Adderall coming up as fake pills, and Xanax. And typically Adderall and Xanax are something that we see very common amongst college students, amongst the youth population. And oxycodone is a pain opioid. So if you have pain, oxycodone is typically something that's prescribed. So, any of these can easily be made in the illicit market and made to seem like it's actually legitimate or actually real. So in this slide here, typically when we present it, we like to get participation from the audience, to showcase by a show of hands who thinks the first one is authentic, or who thinks out of these two, which one is actually the real pill. So we'll just take a moment in the chat if you want to if you think the first line up top is the prescription pill, you can just put one. If you think the bottom is legitimate, you can put two, just to have a little bit of engagement in the chat. Okay, so I see a different mixture of of answers. I see ones, I see twos, I see ones, and I see twos. So let's see what this one. Okay. So as you can see, the top is the authentic, it's the real oxycodone, and then the bottom is fake. Um, I would say even from our chemists in our DEA lab, that they can look at these two pills and not even know which one is the legitimate or the real pill. So you can imagine that any youth or anybody that has an experiment, they might look at it and say, yeah, I think this is the actual real pill. And so again, we really try to emphasize the importance and the awareness piece of when you're seeking in the illicit market or in the black market, that's not something that you're getting from your pharmacist or your doctor. You're at risk of getting something that's not legitimate. Okay, let's do the same example for this one. These are Xanax pills. If you think the first one is real, put one. If you think the second one is, you can put two in the chat. Okay, and this one I'm seeing a little bit more of a consensus on one. Okay. Yep. So as you can see, the authentic Xanax is on the top and the fake is on the bottom. Again, if somebody were just to look at them that has not experimented with drugs or don't really understand it, just by looking at it, they wouldn't know which one's the real thing. And so when we mentioned or we talk about that, I like to bring up the cookie analogy. And I like to share a real story that one of the parents that we worked with that lost her son. When we talk about people pressing these pills, it's not a chemist putting it together. So you have a mixture that is pretty much a filler, and then it has the active substance, which is fentanyl, and then you put it together. So it goes from just the substances to adding the fentanyl, and then creating it into a tablet. And so at the bottom, you can see there's four different pills, or sorry, five different pills. One, in this case, we'll talk about has no fentanyl. On the second one, it just has one little speck on the left side. On the third one, there's a couple steps on the right and then a one on the left. The fourth one, you can kind of see that it's a little bit more divided. And then number five, you can really see that both sides has pretty much an equal amount of fentanyl. And so, as I mentioned, the cookie analogy is when you're baking cookies and you're putting chocolate chips, you don't necessarily know how much chocolate chips are going to be in each cookie. And this is kind of the same thing. When fentanyl is not regulated and they're being pressed, you don't really know how much fentanyl is going to be in it. And half of the time, people aren't seeking fentanyl in these incidences that we see. And so, with this parent, she shared her story that her son and his friend were at a party and they decided to split a pill, what they thought was an oxycodone. They split it in half. Her son overdosed and his friend lived. And so we can even see that with this example and what's on the screen is you don't necessarily know how much it contains, and also how your body how much your body can take when there's a equal or little amounts of fentanyl. So it's also important to highlight, about how it's made, how is fentanyl made, and how it looks like in different settings. So this is an example of a medical grade lab. So this is actually where fentanyl is made. If it's used for medical purposes, if it's actually something that's regulated. As you can see, it looks clean. It has different regulatory compliance notices. it just looks different, right? It looks like something that's actually manageable and it's actually regulated. Now, on the next slide, this is actually one of our seized locations down in Mexico. This is where fentanyl was created or is created. And you can see it's not something that's regulated. It's not something that really is sanitized or clean. You pretty much have the open containers of everything throughout. And again, it really showcases how fentanyl is created. It's an easy product to make. It doesn't take that much supply as like a heroin. When you had the poppy plant, you had to wait for the poppy plant and have the water supply and all those things that go into something like heroin. Fentanyl, you don't need all those things, and it's easy to make. It's cheap to press and to distribute. So as a business model, it's an easier way to make profit. So with that, even the distribution of drugs has changed. A couple years ago, typically in the past, you would have to go to a sketchy part of town or get it from a drug dealer that's, you would have to meet at a certain point. Really with social media and so many different platforms, even drug distribution has changed. And so we've seen, even in the last couple of years, how the conversations of drug selling has changed. And now they really have been using emojis to kind of keep up with the young population and distribution. Now, this slide came up or was created in 2021. I honestly wouldn't be surprised if some of these are outdated or if they've already changed or already evolved. But kind of going back to the story analogy, some of the parents have even said, I had no idea that my son was seeking drugs, and let alone that it was delivered directly to my house, like a Uber Eats or like a DoorDash delivery. The drug dealers had a system where they just delivered it right to their home. And so I know a lot of you guys go into homes and educate parents, but even if you're a parent in this presentation today, feel free to take the information and apply it. If you have any additional information on what you want to learn about the one pill can kill message or anything on fentanyl related, please feel free to let me know as well. And so with fentanyl, I like to highlight, the different types of victims. Um, Especially with drug experimentation, people had this notion that it's only people who have a substance use disorder or who have a problem with drugs. And fentanyl really has changed that. And so the first one, they have it labeled as child, but this is anybody under the age of 18, where they're not seeking fentanyl. They're attaining a fake pill to self-medicate, to cope with their feelings, or even just to be curious and trying something. Again, they're not seeking fentanyl and they get a fake pill. The next slide or the next thought is recreational. Now, this is somebody that might use drugs to party, to socialize. And this is what we've seen with cocaine. Somebody who's experimenting with cocaine, again, they're not seeking fentanyl, but sometimes fentanyl can look like cocaine. And so just from doing investigations, we see that they were requesting cocaine and they actually ended up getting fentanyl. The legacy, this is somebody who has had a chronic, who suffers from chronic pain, and that possibly can started off with a prescription drug, a prescription pill, prescription medication from an actual doctor, and for whatever reason, couldn't obtain a prescription anymore, couldn't obtain their medication anymore, and again, not seeking fentanyl, but ended up getting something that was not legitimate. And lastly, we have dependence. This is somebody that is seeking fentanyl. And, we do see cases like this of somebody who already has experimented or tried fentanyl, and that really is what they're seeking. So their dependency on drugs or how their body reacts to this particular drug isn't the same as like somebody under 18 that's the first time using. And so this has paint a picture and has changed really the drug experimentation field, because again, at times you really just don't know what you're getting, especially looking into the black market. And so I wanted to highlight some of the DEA prevention resources that you all can use and learn more about. Starting off with Operation Prevention, this was a partnership that we had with Discovery Education, and it really tried to encompass the different sectors or the different categories where education could take a place. So we have a section for school engagement and for those who are educators or teachers. And so there's different curriculums from elementary, middle school, and high school that it's age appropriate, where they can have lesson plans to talk about drug prevention, drug education. There's also online modules where if somebody wanted to learn about how the science of addiction works or how drugs affect your body, you can learn those different sectors at your own pace. It literally is a video, interactive video that you can follow along and learn more about. One of the tools that I promote heavily is the parent toolkit, the parent resource, which we'll talk about in the next slide. But what I really like about this feature as well, and Operation Prevention as a whole, is that it has opportunity for English and in Spanish engagement. So for those who visit parents that are Spanish speaking only, there's an opportunity for providing a resource and education on that as well. And so Operation Prevention's toolkit has 5 different sections. It starts as basic as learning the facts, as learning how medication works. So it has the conversations or the discussions on what's the difference between an over-the-counter medication, a vitamin, or an actual controlled substance like an opioid that's controlled a little bit more regularly. And then it has parent styles and skills. You know, every parents differently. And so it has different ways on how you can educate or have those conversations with their children about topics like this. And then lastly, skill number 5 is skills that you can provide to your student or to your child. As parents, you can't be with your child at all times. And so if you can give them the skill set to make those decisions, make those healthy decisions when something like being asked to experiment with drugs comes up, then you can add more awareness and education to youth. And just to show an example, this is one of the sections. This is section 4 and talks about start the discussion, as I mentioned, both English and in Spanish. And so, just even learning the science. And this is not a one size fits all, only because your child might be, their grades might be declining, doesn't necessarily mean they're using drugs. But again, looking at the different patterns and looking at the different science that can start a conversation. We also have Get Smart About Drugs. Again, this is not just for fentanyl awareness or education. If you're just interested in learning a little bit more about marijuana or vaping or methamphetamine or any of the other drugs that are primarily happening in the communities, there's a lot of information that you can read upon and learn about. Just Think Twice is a similar website to Get Smart About Drugs. It has a different drug stats, the facts, and then promoting really living a drug-free lifestyle. On the right is 2 examples of the Operation Prevention school engagement. It's the high school one. Typically, I like to highlight that one when I go to high school students or high school classrooms and I talk about it, because it really has an opportunity where the youth can take ownership and really educate their peers on drug awareness pieces. So to emphasize on the One Pill Can Kill campaign, it's really learning about the dangers and the accessibility of drugs online. As I mentioned, the drug market has changed where now drugs are easier obtained on social media platforms and online. We emphasize to not just youth, but to anybody, really don't take medication that wasn't prescribed to you by your doctor. And that would just pretty much keep you safe in the sense of, if you don't know where you're getting it from, you really just don't know. And so it's about being mindful of where drugs are coming from and really sharing the message and the information. Like as I mentioned, you all go into the different homes and provide resources. If this is something that you would like to provide, this is easily accessible. And I can even send a box of information if anybody's interested in that. But we're really just trying to spread the information on what we're seeing on fentanyl and just the drug market across the board. If you're interested in getting the QR code, this is a direct link. If not, you can go to the website dea.gov/1pill. And then lastly, as I mentioned, how to get involved, right? It's learning the facts, learning about the different resources that we have. So that would be the Just Think Twice website, the One Pill Can Kill website, and the DEA National Take Back. We typically it takes place in April and October. If you have prescription medication that you no longer need or is expired, we really try to promote taking out the medication out of the medicine cabinet so it reduces an opportunity of misuse. Typically with youth, what we see in our studies is that, they start off with the medicine cabinet medication first. So it really, DEA National Take Back is really to promote getting rid of medication that no longer is needed or isn't used. We have our Instagram, DEA Los Angeles. If you're interested in learning more of the enforcement stuff that we do, or even the community engagement, we're pretty active on our DEA's Instagram page. So that's where we really have all the information that's going on, not just here in LA County, but across our division. I won't go too much into this. I know because Maddie will be touching upon it, but LA County Department of Public Health has great resources for learning more about opioids and the signs. I'm sorry, opioid overdose signs, and explaining how you can't naloxone or Narcan if you're interested in that. As I mentioned, I won't touch too much on this because I know Maddie's going to cover it on her slide. So I know this is a very important and interesting resource to know about. And lastly, to finish my section of the slides or my presentation, I like to highlight the faces of fentanyl that we have in our DEA's headquarters in Virginia. And all these photos are photos of loved ones that unfortunately lost their lives to fentanyl. And I hear a lot of the stories from the parents because we do family summits and we really engage with them. We really try to bring awareness to what's going on. And so these individuals, I know we hear numbers of how many people die a day or how many people have died from a drug-related death. But all these people have stories and they all are somebody's loved one. And I would say from the wall, when I attended it, the youngest was a 6-month-old baby. The oldest was probably an 80-year-old man. And so with that, it's, this has affected so many families, not just one demographic and not just one socioeconomic or not just one age population. And so I hope that you have learned something today of fentanyl and what DEA is doing and has done, and really spread the information and awareness piece that we are presenting to you today. So here's my contact information if anybody's interested in me and contacting me at a later time. As I mentioned, I do a lot of the community outreach for DEA, to presentations, to community events. And so if anybody's interested in having a more in-depth conversation, please feel free to reach out to me. And so with that, I will turn it over to Maddie.
Hello, everyone. Let me share my screen here. Awesome. Can everyone see that? Yes, awesome. Hi, everyone. My name is Maddie Ward. I'm the Director of Operations for End Overdose. We're a Los Angeles-based nonprofit organization, but I'm going to be talking to you guys a little bit more today about how to prevent and respond to opioid overdoses. Our slogan at End Overdose is "No one else has to die," because we truly believe that by spreading this training information and by carrying naloxone, that statement will be true. So this is a just quick disclaimer. This training is not a substitute for emergency medical attention. No matter what, I'm going to go over this a lot later, but even if you're giving someone naloxone, you're still going to want to get emergency responders on the site. You're going to want that person to seek further medical attention. And there's a number of reasons for this. One being that naloxone is only a temporary solution. It only lasts about 30 to 90 minutes. A person may return to a state of overdose at that time, Additionally, a lot of things can happen while that person's overdosing. They're not breathing on their own, and we want to make sure if any additional damage has happened outside or sorry, occurring from the symptoms of the overdose, that they are seeking further medical attention for that. In addition to that, I will be discussing overdose and drug use pretty extensively throughout this presentation. So if you need to take a breather, anything like that, feel free to take a step back. You're always feel free to like reach out to any of the contact info I put on the last slide to get clarity on any points you might have missed. So who are we? End Overdose is a 501(c)(3) nonprofit. As I said, we're based in Los Angeles, but we do have chapters across the country. We do a lot of work with college and university students. Out in the community, we love going to music festivals, concerts, that sort of thing, training, those sorts of attendees. And then we do a lot of work with recovery facilities across Los Angeles as well. But we're really focused on ending drug-related overdose through education, medical intervention, and public awareness. And so, kind of what that looks like is we provide two main resources, preventative, which are fentanyl test strips, and then responsive, which are things like naloxone, which is really what I'm going to be focusing on today. And we educate and train people on how and when to intervene during a suspected overdose. And we also really just want to engage in more conversations surrounding mental health, addiction, and overdoses, as obviously a lot of those things overlap quite a bit. And so, why do we do this? Drug-related overdoses are the number one cause of death for people age 18 to 45 in the United States. As Ruth kind of mentioned, this is a problem that affects so many different people. It's hard to pin this down as being for one specific demographic in the United States. Like a lot of people are being impacted by overdoses. And in particular, we are seeing that there are over 200 deaths daily from synthetic opioids like fentanyl in particular. So what exactly is fentanyl? I know you've probably heard a lot about it. I know Ruth talked about it a little bit as well. It's an opioid painkiller. It is sometimes used in hospital settings. It's a very, very strong painkiller, 50 times stronger than heroin, 100 times stronger than morphine. And another issue that we're seeing is it's often illegally manufactured. So there's not going to be a lot of regulation of the strength of, or potency of it when it's being manufactured illicitly. It is also highly addictive and can be incredibly lethal, especially for people who've never taken an opioid before. So some fentanyl analogs that we've seen are carfentanil. That is one of the like more common ones, and they can be stronger than the fentanyl that you would typically get prescribed to you in a medical setting. So there are a number of different illicitly manufactured variations. They often have very similar but slightly different chemical structures. And so the amount of fentanyl it can take a person to overdose, like Ruth was saying, it's typically about 2 milligrams, we say is the average, but it can also depend on the analog that that person ingests, their tolerance to opioids or fentanyl in particular, and how it is ingested. So opioids, these are all examples of things that naloxone will work for, because naloxone will work, also known as Narcan, will work for any opioid-related overdose. So codeine, morphine, oxycontin, fentanyl, Percocet, heroin, Vicodin, methadone. And you're going to want to look for the signs that I'm going to go over a little bit more later, just because we do see opioids being laced, especially fentanyl, and a lot of other substances as well. But opioids bind to opioid receptors in the brain, and this allows them to cause pain relief and also pleasurable effects. While they're bound, it also allows them to control breathing, emotion, and sensations. And this is where the issues start to arise when a person ingests too many opioids, a combination of multiple opioids, or maybe they took opioids and something else. An overload on the opioid receptors in the brain causes respiratory depression. 4 minutes without oxygen can cause brain damage. This is very soon after, followed by death, which is why it's so important to immediately respond and immediately call 911 when you recognize an overdose is happening. So just kind of a visual of what naloxone does. Opioids are like these little blue dots and they bind to your receptors. Naloxone comes in and it kicks them off. So it's this red dot with the white plus sign. But while it's bound, it will only stay there for about 30 to 90 minutes. So after that point, if you still have opioids in your body, they will go back to the place that they were before, which is why it's really important that that person gets to a hospital. Naloxone, again, only works for opioid overdoses. It should restore the person's breathing. This is the main symptom it responds to within 2 to 3 minutes. If their breathing's not restored, that's when you're going to want to administer additional doses. And again, it can wear off and that person may return back to that state. So these are just a couple different versions of naloxone. You might not have heard the term naloxone before. It's the generic name for Narcan. Narcan is a brand name. They've done a great job of branding because I would say a lot of people now know naloxone by the brand name Narcan. But there is a couple different kinds. There's also intramuscular injection versions of it. Typically, the one that you'll see most readily distributed is going to be that intranasal spray, and that's what I'm going to talk to you guys about using today. So, responding to an opioid overdose, the first step is going to be looking for those signs and symptoms. What I would say is the most important, most like telltale symptom is going to be those pupils because a lot of different substances will make people's pupils get larger. Opioids make people's pupils get smaller. So this is a great one to look for if you think someone's substances might have been laced with something else, but also just a great one to look for if you see someone who looks like they're passed out, looks like they're unconscious. If you lift up their eyelid and look at their pupil and its pinpoint, that's going to be a huge sign that that person's having an opioid overdose. And that pupil is going to be unreactive to light. So whether there's a light in it or out of it, it's going to remain extra, extra small, extra, extra small. So that's another way that you can check. And then their breathing is going to be slowed or stopped. So as I mentioned earlier, this is going to be the life-threatening side effect of opioid overdoses is that person is not getting enough oxygen. And so to check their breathing rate, you're just going to put your ear near their nose and mouth, and you can watch their chest rise and fall. Typically, someone will breathe about 1 time every 5 seconds or 12 times per minute. If it's significantly less than that, or you hear them gasping or gurgling, that's going to be another sign that they're having an opioid overdose. And the last thing is that they're going to be unconscious. They're not going to be reactive to noise. They're not going to be responding back to you if you're talking to them. In all likelihood, they will kind of look like they're asleep. You can pinch up here. We call this a trapezius pinch. Sorry, pinch right here. And that should wake them up if they're just asleep. There should be some sort of reaction to that if they do have some level of consciousness. But if there's no reaction at all, that's going to be your third sign. Yeah, so as I just said, you can also do a sternal rub as well. I would recommend doing a trapezius pinch just in case that person has any injuries or anything on their chest. Just avoid that area and do the trapezius pinch. And you can also like yell their name if you know it, shake them very lightly, just to see if they will wake up at all. And then the next thing you're going to want to do is check for breathing and a pulse. So again, like I said before, ear near their nose and mouth, watch for that chest rise and fall. For their pulse, you can check that on a person's wrist right here, or you can kind of lace down from your ear down their neck. But a good thing to note is that breathing is again going to be one of those main symptoms of an opioid overdose. That's going to be one of the first things impacted by ingesting too many opioids. So their pulse might not decrease immediately. It's probably going to decrease more in response to that lowered breathing rate. So I would recommend if they are gasping, gurgling, you see the pinpoint pupils, and that person is unconscious, that's going to be pretty much telling you that that person is having an opioid overdose. The last thing is going to be calling 911, yelling for help. If you're in a crowded area, like have someone else call 911 for you. Make sure you like point to someone and say like you call 911. It is always important to note that in California, there is protections for individuals who are responding to emergency medical situations. There's different versions of the Good Samaritan law in a lot of different states. California has pretty wide protections, though, I would say. So no person who's acting in good faith and not for compensation to render care during an emergency medical situation, they will not be held liable for any civil damages resulting from any act or omission. And what that not for compensation piece means, because I know sometimes people will be like, well, if I'm like working on my job and I give naloxone to someone that I'm working with, is that considered like for compensation? It really just depends on kind of what the details of your specific role are. If you're required by your role to administer naloxone to people and to render emergency medical care, then it's gonna maybe not fall under the Good Samaritan law, but that section of the law is more intended to refer to like paramedics, doctors, that sort of thing, like when they're on call, the Good Samaritan laws are not going to apply to them. But if they're in their day-to-day life, it likely will. Another addition to that law is just that if you have drug possession or drug paraphernalia possession, you're not going to be held for criminal prosecution as long as it pertained to that emergency medical situation. There are a couple cases, where this would not apply, and that's going to be if you could be charged with other crimes like trespassing. Trespassing, if you're on parole or probation, this is likely still going to be a violation of that. And then more drugs than is considered possession for personal use. So any amount that suggests trafficking or sales, that is still going to be illegal. And obstructing medical or law enforcement personnel in any way is also not going to be allowed. So just make sure once they get there, you step out of the way, let emergency responders do their thing. But yeah, and the most important thing I would say to note about this law, though, is in the event, like someone shouldn't not call 911 during an overdose because they're worried about getting in trouble for having drugs involved in the situation. And it is known that drugs are going to be involved in the situation, but the main focus of those emergency responders is going to be on providing that person overdosing with further medical care. Step number 5 is going to be administering the naloxone. So you know 911 is on the way, you know emergency responders are on the way. You're going to go ahead and give that person a naloxone dose. I have a little example right here. So you'll put 2 fingers. Sorry, it's not going for it. Okay. You're gonna lay that person flat on their back. You'll peel it out of the packaging. Put 2 fingers on the top of the spray. Put it all the way up that person's nostril and push that plunger all the way down. Again, it should work in about 2 to 3 minutes. You can also tilt that person's head up when you push the naloxone in, just to make sure it does all absorb, but it's going to be absorbed by their nasal lining. There's a couple different instances, right, where this person might need a couple doses if they've taken a lot of opioids and it's going to take extra naloxone to pull those opioids off those receptors. That's one case where they might not wake up immediately. Another case where they might not wake up immediately is if that person has prolonged substance use, particularly like snorting drugs. They might have built up scar tissue in their nose that prevents that naloxone from being absorbed as easily. So those are some of the reasons why you might have to keep giving additional doses of naloxone. I recommend switching nostrils each time just to kind of account for that. But in between doses, like while you're waiting for the dose to kick in during that 2 to 3 minute period, or let's say you find yourself and you don't have any naloxone on you, you can go ahead and do what we call rescue breathing. And this is just responding again to that fact that that person is not breathing on their own. So you're already going to have them lying flat on their back from giving them the naloxone. Just go ahead, tilt their chin up, pinch their nose, and you're going to breathe into their mouth 1 time every 5 seconds. You'll see their chest rise every time you do that. If you see their stomach rising, it means that you have not adequately opened their airway. So just go ahead and adjust that tilt you have on their chin until you see that chest rise and fall. Check for any obstructions as well if necessary. But yeah, you're going to want to make sure you pinch their nose just to form that seal. But just to recap, here, actually, I'm going to go back, sorry. But in the event that that person does wake up after those 2 to 3 minutes, let's say you're doing the rescue breathing, you see them stirring a little bit, you're going to want to put them in what we call recovery position, which is right over here. So just put that person on their left side with their arm and leg at an angle, so they won't turn over. In some instances, people do throw up when they wake up from being administered naloxone, so we just want to make sure that that person doesn't choke and that they're going to be okay. Okay. Again, this is the rescue breathing. But just to recap, if you notice any of these things, so if you see someone with large pupils, normal pupils, or they're breathing normally, or they're able to respond to you touching them or speaking to them, that's going to be a sign that it's probably not an opioid overdose. We have been seeing a lot lately, like if it looks like an overdose situation, sometimes people just really jump to administering the naloxone, which is awesome because naloxone has no life-threatening side effects. So if you give it to someone who's not overdosing, they are going to be okay. But we want you to make sure that if it isn't an opioid overdose, we're providing emergency responders with the best possible information, and we're knowing that maybe naloxone's not going to work for that case. So if you see these signs, that's when you're going to want to call 911 still, but you might not have to administer the naloxone. So again, anytime you see a medical emergency, call 911, but naloxone is only going to work for those opioid overdoses. So slow to stop breathing, in any case, you can always utilize rescue breathing. That's a great tool to use whenever you notice that someone is not breathing anymore. Vomiting, you're going to want to put them in recovery position. Always a great tool to use for anyone throwing up, so you can take a step back away from them as well. And just some things to quickly consider. Again, I know I've mentioned this probably 400 times. You're probably sick of hearing me say it, but please make sure that person gets to a hospital immediately. Naloxone only lasts 30 to 90 minutes. It's really important that they get further medical attention. Additionally, it has virtually no effect on someone who's not overdosing. Like I showed you earlier, it will bind to those opioid receptors, but it's not like opioids. It won't give someone any of the effects that an opioid does. It really just kind of sits like a little placeholder saying no one else can be here. So it's not going to hurt anyone if you give it to them when they're not overdosing. Naloxone allergies are very, very rare. And yeah, you're already going to have 911 on the way. And obviously, something else is going on if you thought they were overdosing in the first place. And naloxone can cause withdrawal symptoms. So if a person is overdosing and they're given naloxone, this is more so going to happen if that person is someone who has taken opioids for a long time. They have substance use problems surrounding opioid use. Those withdrawal symptoms might be a little bit more intense. So it can make them nauseous, irritable, it can cause cramps. They also might want to take more substances because essentially that naloxone's making them go from having the most opioids they've ever had in their system to no opioids at all in just a matter of minutes. So it's not the best feeling in the world. So just make sure you stay with that person, take care of them, but also take care of yourself. If you notice them waking up, that's why we recommend putting them in recovery position so you can just take a step back if needed. But that's pretty much it. There's a lot of different options. I'm going to send a couple links in the chat here, but there's a lot of different options for how you guys can get naloxone. As just an individual, I totally recommend checking out the LA County Library's website because they do regular distributions at so many of the different locations. And you don't even need an ID to pick it up. You just show up there and they'll give it to you. And then I'm also sending a link in the chat. This is for like larger organizations. If you on a more regular basis want to be giving out naloxone, or it's something that you maybe want to provide to some of your clients, you can order it from the state through that link. If you want to order it through from End Overdose, we're based in LA, so we can do drop-offs in a lot of places throughout LA County. You can shoot a message to admin@endoverdose.net, or you can email me personally at maddie@endoverdose.net, and we can set up a naloxone distribution for your agency. But yeah, you can also go to endoverdose.net or direct anyone you know there to get free naloxone shipped to them anywhere in the US.